Diane Keaton recently died of bacterial pneumonia. What is bacterial pneumonia exactly? Hi, everyone. I'm Dr. Omer Awan. I'm a physician and senior public health contributor for Forbes. I want to demystify bacterial pneumonia because Oscar award-winning actress Diane Keaton died of this. So hopefully all of us can learn something about bacterial pneumonia, what it is, and how we can prevent ourselves from getting bacterial pneumonia. So pneumonia, as you know, is just an infection of the lung. It's when pus and fluid lines the cavities of the lung and results in infection of the lung. And the infection can be caused by a wide variety of sources, things like bacteria, viruses, fungi. For bacteria, which was the case for Diane Keaton, which is the most common cause for pneumonia, typically it's from a bug or a bacteria called Streptococcus pneumoniae, but it can be many other bacteria that cause pneumonia. For viruses, it can be respiratory viruses like COVID-19, the coronavirus, right? It can be the influenza virus that causes the common flu. It can even be RSV, the respiratory syncytial virus. All of these viruses can cause pneumonia. And even fungi or fungus can cause pneumonia. And that typically happens in patients that are immunocompromised or they have weakened immune systems, maybe patients that have HIV or on chronic steroids, or maybe they have cancer. They're more susceptible to getting fungal pneumonia. So, how does pneumonia present? What are common signs and symptoms of pneumonia? So typically, a patient is going to have a fever. They may have a cough. It may be productive. It may be non-productive. They may have chest pain. They may have shortness of breath. They may be tired, have malaise. These are all symptoms of pneumonia. Now, certainly, if you have a very high fever, if you have shortness of breath and you have difficulty breathing, then you should consider going to the emergency room and get treated. But as you know, pneumonia can range from something that is very mild to life-threatening. So you can literally have pneumonia in your house, you treat it with antibiotics for 5 to 7 days, and you're good to go. But for some people, it can be so severe and life-threatening that they have to go to the hospital, they have to get treated. They may be even put on a ventilator because they can't breathe properly. So you can see the wide spectrum of pneumonia, how it can be very, nonchalant, or it can be life-threatening. It can even cause death, for example. Now, why is it that elder individuals like Diane Keaton, for example, are more susceptible to pneumonia? Well, there's a couple reasons for that. One is as we age, our elasticity of our lung decreases and our cough reflex decreases, which means that we can't expel, mucus or even those bacterial particles or those viral particles from our lungs, which can result in the pneumonia being more severe in our lungs. And also, as we age, it's much more common for us to have underlying chronic medical conditions, things like, heart disease, lung disease. Maybe some of us have diabetes. Maybe some of us have cancer. We have so many other things, and that can cause wear and tear on our body, and that can prevent us from recovering effectively from the pneumonia because our immune system naturally weakens as we age because of those things. So that's why particularly elder individuals are more susceptible to pneumonia and more susceptible to the complications and more susceptible to having more severe pneumonia where they may have to be hospitalized, may even have to be put on a ventilator where they can't breathe properly because of that pneumonia. So, what can we do to prevent pneumonia? Of course, pneumonia is treated based on whatever the cause is. So, if it's a bacteria, we give antibiotics. For viruses, we just, do supportive therapy. Sometimes there's antiviral medications. Same thing with if it's a fungal pneumonia, we can have antifungal medications. But what can we do to prevent it? Well, a lot of those viral causes, like coronavirus, influenza virus, RSV, they have vaccines that you can use that can help prevent the pneumonia or certainly mitigate or decrease the amount of symptoms that you would have to make the pneumonia much less severe. Now, for the most common cause of bacterial pneumonia, there's actually a vaccine as well, the pneumococcal vaccine, which actually the CDC recommends everyone under the age of 5 or 50 years of age and older take the vaccine. And actually, this is relatively new because just last year in 2024, the CDC changed the guidelines from 65 years of age and older to now 50 years of age and older. And that's because more and more people are getting pneumonia. I mean, this results in more than 1 million ED visits every year in America. So, very important for people to get vaccinated to prevent pneumonia, but also just common sense things like washing your hands frequently, covering your mouth and nose when you sneeze or you cough, staying away from people that are sick, staying at home when you are sick. All of these things can really help prevent getting pneumonia. And obviously, if you're in crowded areas, you want to mask up, right? Because that can prevent you from inhaling or taking in, bacterial or viral particles that can then cause the pneumonia. So those are all things that you can do to help prevent pneumonia. So I hope that was helpful. Hope that demystified what actress Diane Keaton had. And as always, please consider subscribing to our MedEd page and supporting our mission of global and public health.